Hi everyone, welcome back to your channel. I love pharmacology. In this session, again, you're going to learn a very important uh, topic, that is therapeutic index. So, whenever we think about index, census index, therapeutic index, it tells about something about a risk and benefit ratio. So, whenever we are addressing a risk and benefit ratio, you're going to look for a safety. So, we need to take care some safety, whether you are getting a benefit or a harmful effect. So, whenever there is a benefit outweighs the harmful effect, only on such occasions we are going to use the drug. So, otherwise, drug will not come into market at all. So, what do you understand by therapeutic index? Let us understand these four important points. So, here you need to understand two things. One is the ED, and another one is the LD. ED stands for effective dose. ED stands for effective dose, and LD stands for a lethal dose. And LD can be interchanged with the TD, that is the toxic dose. Toxic dose. So, what do you understand by effective dose? Especially effective dose 50. Effective dose 50. So, effective dose 50 means it is the dose at which 50% of the individual will going to have a desirable beneficial response. So, what do you understand by LD50 or TD50? Lethal dose 50 or toxic dose 50? So the lethal dose 50 suggests that it is a dose at which 50% of the individual will have harmful effect. Harmful effect. If you take a animal, the definition will go like this. It is a 50%, it is a dose at which 50% of the animal gets killed. Animal gets killed. Whereas in the human, it is 50% of the individual where you are going to see some harmful or adverse drug reactions. So ED50 is a measure of the potency. ED50 is a measure of the potency, effective dose, which is required to produce a desirable response. The amount which is required to produce the response, that is a potency. Next, we have a lethal dose or a toxic dose. This toxic dose is referred whenever we talk about the animal studies. It is a dose to kill a 50% of the animals. So there is a formula which representing a therapeutic index. It is given by lethal dose 50 divided by effective dose 50. So it is the therapeutic index formula, very, very important. And apart from that, you should also remember therapeutic index is a measure of what? So please remember therapeutic index is a measure of safety, safety of the drug. So how to remember this therapeutic index? If you don't, in your exams, what will happen is this will be a very, very confusing whether LD50 will come at the top or ED will come at the top. So for this, a just simple mnemonic is you can remember it as tile, tile. So TI stands for therapeutic index. The next L stands for lethal dose, 50%. Next divided by effective dose, 50%. 50%. So lethal dose will the maximum dose at which the person will going to experience the side effects clinically. Effective dose is the dose at which a minimal dose at which it will going to produce the beneficial response. So this was all about the therapeutic index. Only if the therapeutic index is good, you're going to use the drug. So there are some low therapeutic index drugs. For such low therapeutic index drug, if the therapeutic index is low, what will you do? You will go for therapeutic drug monitoring. Therapeutic drug monitoring. So monitoring has to be done to prevent the adverse drug events as well as subsequent harmful effects. So please remember therapeutic index means style. Therapeutic index means style. Tile. Tile. Thank you.